Okay, the title of this talk is Why Healthcare Costs Are So High. And the reason I'm speaking on this is I think healthcare is going to be a big topic in the coming years. And the reasons why it's so high are largely hidden from view unless you're part of the industry, of which I was for 20 years. So I'm going to talk a little bit about that and hopefully inform you so that when this comes up in terms of the baby boomers retiring and Obamacare not cutting the mustard, so to speak, that you have a way to come back and explain what's really going on, and you have a solution to present. Because after all, if we get out there and our activists in our communities, people are going to be looking to us for solutions. So let's talk about that. So there are several things that people talk about. For example, the runaway civil suit awards. For example, when my employer, Upjohn, put out tetracycline, it warned people don't give it to young children because they'll turn their teeth yellow. Nevertheless, we got sued regularly and had to pay damages for physicians that didn't follow this instruction. So, this is kind of crazy. And of course, we've seen that when you have a medical savings account, you can get people to really look at the costs and choose differently than if they have a low deductible insurance program, because if they have a low deductible insurance program, they can go out and get medical attention and they don't care what it costs. But when they're shopping on their own and their medical savings account is going to be charged for some of the services, they make sure that they get a good deal. They check the hospital bill, make sure they're not being charged for something they didn't receive, for example. And what's been found with the medical savings accounts, of course, is that can cut expenses 20 to 30%. And that's really good. I mean, those are good things. But really, the thing that most people aren't aware of is that medical costs are high, mostly because of licensing regulations. And we're talking about, they really contribute, I'd say, 50 to 90% of the costs. And I'm going to demonstrate that for you today so that you have some intellectual intellectual ammunition. We don't want the inhibition. So these licensing laws not only cause prices to skyrocket, but as I'm going to show you, they inhibit innovation. And innovation is important, especially in medicine, because it means the difference in a high cost or low cost. How they say an ounce of prevention is worth a pound of cure. That's really quite literally true in terms of costs. And that's another thing I want to talk about. Our current regulations actually favor therapy over prevention. They drive all of our medical research towards therapy. In other words, after you get sick, instead of preventing you from getting sick. And so I'd like to really have you get a good grasp on that, because this is where the libertarian solution to healthcare is in getting rid of these regulations that prevent us from doing the smart things that we should do. And I'm going to focus on pharmaceuticals because pharmaceuticals are regulated nationally by the Food and Drug Administration. So it's much easier to focus in on them. And I'm actually going to take one specific piece of legislation and show you how much that particular legislation cost us, because it's easy to do on the national level. What's harder is the licensing of medical personnel like doctors and physician's assistants, nurses, and hospitals, because that occurs more on a statewide level. That's hard to quantitate, but it's easier to do the national. However, they're about equivalent in terms of their impact, I believe. So I'm going to talk to you about the 1962 Kefauver-Harris amendments to the Food and Drug Act. These were passed in the wake of the thalidomide tragedy, which many here in the room probably remember. What happened was there was a safer sleeping pill. By safer, I mean safer than barbiturates, that was marketed in Europe. And women started taking it for morning sickness because they discovered it worked. Unfortunately, if they took it in the first, I think it was 6 to 12 weeks of pregnancy, their children were born with a missing limb. Now, this didn't happen in the U.S. much because the Food and Drug Administration hadn't approved the drug. So it didn't happen here, it happened in Europe. But nevertheless, the American public was kind of concerned about this, and Congress used it as an excuse to pass a law that had been bouncing around Congress for about 3 years. with safety. But what it did do is it gave the FDA authority over drugs in manufacturing, animal testing, human testing, and marketing claims. Prior to passage of this act, a pharmaceutical company would test the drug however they chose, in animals and in people. They would submit the data to the FDA, and the FDA would basically say, yes, we approve it, or no, we don't. And they only had to show that it was safe for the intended use. They didn't have to necessarily show it was effective. Of course, most companies, what they did is they gave their new drug to doctors, had them give it to their patients, and if it didn't work, they didn't market it because it really wasn't going to make them much money. But there was a concern that there was a concern by the FDA that maybe they should have a little more power. To make a long story short, this had a major impact on the ability of a company to take new drugs to market. What you're seeing on this slide is the blue bars, which represent the time in years, about 5 years, that it took to get a drug from the lab bench to the marketplace from 1948 to 1961. After the passage of these Kefauver-Harris amendments, you see a great increase, up to about 14 years, a number that is true today, of the time it takes for a manufacturer to take a drug from the lab bench to the marketplace. 15 years. And as you might expect, costs for developing were very great too. Now here is the research and development cost of a single, what we call NCE, in 2003 dollars. An NCE is a new chemical entity, basically a new drug, okay? So, and down here is the year of approval, median year of approval. And you can see by these white squares, before the amendments were passed, there was a little increase every year, and there would have been an increase to about here without the amendments. But the amendments in tripling the amount of time it took to develop a new drug increased greatly. And this number is still going up. It's still increasing. It hasn't gone down. Yes, Dan?
Doesn't that also decrease the payback time?
Oh, of course. Yes, that's a whole other story. I'm actually, the talk I'm giving you today, I'm actually writing a book about it. I can only give you part of it. So unless you ask in the Q&A, you won't hear that part of the story. But we can talk about patents and that whole thing, too. Okay, why is this important? Well, the reason it's important is because what you pay at the pharmacy, your prescription drug expenditures, are directly related to what the manufacturer pays for research and development. Not a big surprise to people in this room. So if the pre-amendment trends had continued, we pay about 15% of what we do today at the pharmacy. That's a huge, huge difference. And that's basically why pharmaceuticals cost so much. But it's not really the price. It's not about the price. And it's really about the lives that are lost due to these delays. Imagine you have AIDS or cancer, and you have to wait, 14 years for the new drug to be available? You can't do it. And we'll talk about real-life situations where that happened in just a minute. Because we know the difference in time between pre-amendment development time and what happened right through the year 2000, we can actually, and we also know roughly how many lives the drugs on the market currently save. You can actually calculate how many lives were lost for the delay that was caused by the amendments. And I won't go through the math, I'll just go to the bottom line. About 4.7 million people lost their lives prematurely because of these delays. Now you might say, well, didn't the amendments save some lives? Actually, they didn't. Here you can see U.S. drug casualties between 1950 and 1962. And if you go through the math, basically, in 2003, by the time 2003 came around, I should say, the amendments might have saved about 7,000 lives, if they could have wiped out all the drug toxicity from 1950 to 1962, which they probably couldn't have. This is a list by another researcher, and what he's done is compiled all the big problems that happened them between 1950 and 1962. So bottom line, to save 7,000 lives, we lost 4.7 million at least, because these delays are just the tip of the iceberg. The tip of the iceberg. It's really scary. And let's talk about this. Why is this? Why didn't more regulation protect us? Well, the reason is that even today, I say most because there have been a few instances where there has been neglect, shall we say, but in most instances, the reason that drugs get on the market that are unsafe is because we don't know any better. There's a lot about medicine we don't know. And we do animal testing, we do testing in people, but most of the problems we have don't show up in small numbers of people. There's only a few people who will be affected, and so many people have to take it before those show up. That's basically what the story is, like I said, except for a couple exceptions. So, when I was in AIDS research in the late 80s, early 90s, what was happening is the AIDS community was basically doing an end run around the system. What they did is they imported drugs from overseas because our FDA was so strict that new drugs came overseas before they came to the U.S., even if they were invented in the U.S. And they would also get black market chemists to manufacture what we were working on in our laboratories, and they distributed them throughout the AIDS community because patients couldn't wait. Now, for the most part, the FDA left them alone. An exception, if you saw the Dallas Buyers Club movie. How many of you saw that? Yeah, Dallas Buyers Club movie, which Matthew McConaughey won a Best Actor award for recently, was the story of one of these AIDS group that brought in drugs and distributed them, but for whatever reason the FDA did go after them, and the Dallas Buyers Club is that story. The reason the FDA probably left most of them alone is the publicity would have looked really bad for the FDA, right? Here's these dying patients and we're taking away their drugs. And even though they did that in the Dallas Buyers Club movie, and did do selective enforcement, they didn't do it in a way that brought national attention. The pharmaceuticals didn't prosecute them for patent violations either. So they were allowed to go their own way. But, cancer patients, they decided they wanted to do it legally. So they sued the FDA for the right to take drugs. They wanted to buy them from the pharmaceutical companies. They didn't want them to give them to them. They wanted to buy them. And they wanted to buy them at the stage in development where they had some human safety testing, but we didn't know yet if they were effective, because the effectiveness testing is what takes so long. They sued on the grounds that the right to life guaranteed by the Constitution should allow them to take whatever they needed to take if they were terminally ill. And the courts ruled that we don't have the right to save our lives unless the FDA has already approved those drugs. Yeah. You can see how health is going to be a big issue in the coming years. A lot of sick people are going to want access to drugs. Yes?
Mary, how do you resolve the conflicting rights issue there in that many pharmaceutical companies don't want to provide the drug while they're conducting clinical trials, because then you can't get the data you need to assess safety and effectiveness.
Yeah.
People won't enroll in the trial because they're all doing compassionate use.
Right.
And you could argue that the pharmaceutical company has a property right in the compounds that it is discovered and is in the process of developing.
Well, I believe
balance
that
the two rights.
Well, I believe that the pharmaceutical companies would if they didn't think they were going to be punished by the FDA. Unfortunately, when the pharmaceutical company does what's called a compassionate use (IND), and they, for compassion reasons, give a patient a drug, it's a terminal patient, right? And then they die. The FDA looks at that and said, well, that kidney damage might have been caused by the drug. Then they make the pharmaceutical company do a whole new set of studies. So even though the compassionate use program is in place, they don't want to do it. And there have been arguments, such as the ones that you've made, that, hey, we should sacrifice the current people so that people that get these diseases later on will be assured that what they're taking is effective. But we can get more into that. I want to go through this and then take any questions. So if you don't mind, let me do that just so I can give you some information. Because I think this is important for you to know. Okay. I told you that 4.7 million was the tip of the iceberg in terms of people who have lost their lives because of these regulations. There's an even bigger number. It's kind of hard to determine exactly what it is. I think between 4 and 20 million people who have lost their lives because innovation has been destroyed. And I'll give you an example from my own laboratory. I actually got a call from an FDA examiner one day and said, Dr. Ruwart, I understand that you have a patent for prostaglandins and liver disease. Is that true? I said, yes, we just filed it. The FDA examiner said, this is wonderful. 100,000 people die every year from liver disease and we have nothing to give them except bed rest. So we'll do everything we can to help you get this drug to market. Well, I was young and naive and thought this really meant something, right? But the problem was this. When you're curing a disease that hasn't been cured before, you don't know how much of your drug to give. You don't know how often you need to give it. And in an instance like liver disease, where the disease takes years to develop, it may take years to cure, too. How many years do you give it? And what do you measure? You can't just take a piece of a person's liver every so often, right? That wouldn't really work well. So if we did not guess all of these things right the first time and do a study that had a certain statistical significance that the FDA liked, we'd have to start over again. And since we have to have 2 such studies, by the time we got done, the patent would have run out and our compound would have gone generic the first day it was out. We'd never recover our development costs. So the company, in spite of the FDA's support, decided not to develop this. Later studies showed that similar compounds did seem to be helpful in liver disease. So this is something that's been lost, and innovation is important because, think about it, if you don't have, for example, the Rothschilds, we all know, the banking society, the founder, Nathan Rothschild, actually died of infection because there were no antibiotics. Didn't matter how rich he was, he couldn't buy something that hadn't been invented. And this is the problem with loss of innovation. Innovation lowers costs, too. The first anti-ulcer drug, Tagamet, when it came out on the market, it replaced surgery. Certainly, it was expensive. I think it was the most expensive drug at the time, maybe except for chemo. So it was like $1,000 a year. You had to take it for 2 years, but you saved yourself an operation that cost $25,000 and took you out of work for a while. So that's why innovation is so important. But studies show we've lost at least 50% of our innovation. And it's still only the tip of the iceberg. But let me summarize so far before I get to the rest of the iceberg. So, loss of innovation probably accounts for about 80 to 30% of healthcare costs. I apologize for not being able to show you how I calculated it, but I have a small amount of time right now. Delays, about 9% of today's health costs. The higher pharmaceutical prices, 8%. Now, that doesn't sound like much, but when you consider that the total healthcare cost for pharmaceuticals is 10% of the budget, 8% is 80%. I mean, this is a big. So, that's a pretty big thing. And then, so if you take the total from the Kefauver-Harris amendments, it's about 25 to 47%. And state and local regulations are probably the same thing. This is the biggie, in my opinion. The reason that healthcare costs are so high today. Let me back up, though, and just say that, as you can see, if you wiped out many of these costs, healthcare would be extremely affordable. It would be about 10% maybe of what we have today. Again, depending on what assumptions you use. But this is the biggie, prevention. Obviously, if you can prevent disease, your costs for care are going to be less. But one of the things that these regulations did is they basically told the FDA, you cannot let a drug on the market that is not effective. And the FDA defined effective as 2 U.S. studies with statistical significance of 0.05. If you're not into math, don't worry about that. That's just for the geeks among us. Okay, so what that means is that, for example, inexpensive unpatentable products or compounds that are off patent, because you have to have a patent to make up this kind of money that we showed earlier. Before that, companies didn't really care that much if they had patents or not. It was this development cost that really forced the patent issue. So if you can't patent it, you can't make the claim. And to give you an example of how this actually created an American thalidomide, when folic acid, a B vitamin, was discovered to prevent spinal bifida and other birth defects in the early 1980s, the folic acid companies wanted to advertise because you had to take it early in the pregnancy. Most young women didn't even know they were pregnant when these problems actually occurred. So they wanted to advertise, hey, all young women of childbearing potential should think about taking folic acid supplements to prevent these birth defects. FDA said, no, we'll shut you down if you do that because folic acid is a drug. You are making a disease claim, so you can't do it. Even after the Center for Disease Control, another government agency, told young women to take folic acid, the FDA said, if you even mention the CDC claim, we will shut you down. So it was about 20 years before, 15 to 20 years before the knowledge about folic acid was really out there in the American public. And during that time, many children were born with birth defects that caused them to be institutionalized. Probably, in my estimation, more than all the thalidomide babies put together. So this is very, very sad. And this is repeated on and on and on. The FDA has actually sent out letters to diamond walnuts and cherry growers and said, take off your website all these studies that show that the compounds in your products help people, prevent cancer, whatever. So they said, the letter says, the way you are advertising your walnuts makes them a drug, so you have to submit all this paperwork, go through all this process, and spend all this money, or not make the claim. That's crazy. So you can kind of see where something that incredible, where you can't talk about prevention, might be problematic. Now, because of this, when we train our physicians, we do not teach them much about nutrition. Unfortunately, if we did, maybe this would help, but we don't. And that's partly because of the milieu surrounding the FDA. We are teaching them more about pharmaceuticals than nutrition. Now, I work for a pharmaceutical firm. They are so appropriate in some cases, but if you can do it with nutrition, if you can prevent the problem, why not? I can't even begin to estimate how many lives that has cost. So, what I want to leave you with here today is that government regulations at all levels are the ones that are driving up healthcare costs. They'd be a mere fraction of what healthcare is today without these. And I've only really focused on the pharmaceuticals for you. So what I'm hoping is when the time comes, we will be able to talk about where the problems are, because most libertarians even don't know that's the regulations that are really driving up healthcare, and not greedy pharmaceutical firms or greedy doctors or anything else. So, thank you. I'll take questions now.
I'm a former nationally registered paramedic, and I spent a couple years working in the emergency department of the hospital, our county hospital, or actually the regional hospital in Georgia. And I'm referring to your state and local licensing pushing the cost of the hospital. I mean, I never heard that before. I'm not disagreeing with it, but I remember the one thing that everybody was always scared of in the hospital was basically a Joint Commission inspection. But I think that was the name of it, right? Wasn't there an acronym for the Joint Commission of Hospitals?
I don't remember that. I was thinking more of the regulations before the hospital's built.
Okay.
Like how the hospital has.
But basically, most of the people that were on the floor felt as though that the hospitals were and the healthcare is basically a business, and they've got a board of directors who earn some pretty handsome salaries, a huge staff that has to be paid for, MRIs are millions of dollars, so they would shuffle us around to basically try and save money in personnel costs, never to reduce the expenses that the hospital, or never to pass those savings on to the patients. But I'm just kind of curious, how do you have any input on that? I mean, because, I remember being told we'd have a completely ambulatory patient. We basically would have to find in the Medicaid and Medicare code book something to bill them for. So I mean, do you disagree that there are some? I mean, I really feel as though the board of directors of a hospital and shareholders in this stake pretty much drive the cost more so than state. I mean, because they wouldn't be in this. They wouldn't even be in business if there wasn't a really nice profit behind healthcare.
Let me talk a little bit about what I meant by it, because I didn't have much time to share on that. Before a hospital can be built, it has to actually approach a number of agencies, depending on the state, and get permission. They just can't spring up overnight. And one of the things that happens is they have to show that there's a need for it. So sometimes other hospitals in the area, of course, say, no, that's not the case. The hospital itself also has regulations it has to use. For example, when my sister Marty was sick, maybe this might be, I think this is a hospital regulation, but it might be a federal regulation. What happened was she was on basically a morphine drip. And she got a new bag just shortly before I went to dinner. She was fine. When I came back, she was screaming in pain. Obviously, the bag had not had the right amount of morphine in it. Well, it turned out that the nurse was not allowed to turn the morphine drip on. A doctor had to be called, and there was no one there at the moment who had that controlled substance license who could do it. So it took about an hour for somebody to get there and do that. Now that's what I mean by regulations. It's kind of silly. Obviously, everybody around knew there was a problem. So that's the kind of thing. And also what happens is the physicians, it used to be when you trained a physician could apprentice with another doctor. And, they could get their medical degree that way. There were also night courses they could take. But around the turn of the century, the turn of the 1900s, early 1900s, they decided you had to go to a full-time medical school. And, of course, that meant you couldn't really work while you were going. So now, only if you were fairly well-to-do could you afford medical school, or you could take out a big loan. And so that really cut down on the number of students that could go, and actually half the medical colleges that time didn't meet the accreditation standards that the states put on. And they did this they did it through the AMA. In fact, the AMA actually ran an article in the 1920s saying we have to reduce the number of physicians. We have to have professional birth control so our salaries will go up. So that's another thing. You can't, they're limited in the number that they pass and give degrees to. And back when I was younger, they didn't even have physician assistants. That was considered a no-no. Now you have nurse practitioners. That's right. That's right. So things have changed. So there's a whole regulatory apparatus around medical personnel and hospitals. I'm not as familiar with the hospitals as I am for the medical personnel, but basically it's rigged so that you have too few people. And if ever you have been, I hope you haven't had this experience yet, but most of us will at one time. You have a loved one in the hospital who's dying. You better be sleeping at their bedside, because if you're not, the overworked staff is not going to be able to give them the care you would like them to receive, not because they're not trying, but because they're understaffed, because of some of these considerations. And the squeaky wheel gets the grease. So, yes.
What about, there are drugs that have been in past trials in other countries and have had real-world use where we know the efficacy of the drug, and yet the FDA does not take that into account. They just keep on with their regulations and their testing.
That's right.
Is there any way to change that?
Well, there is a move to change that. Actually, there's a move to harmonize all the regulations of the world, by which they mean they want to make them as strict as possible. Yeah. And in fact, in some places, like Germany, they are regulating the strength of vitamins. So if you want to take more than 200 milligrams of vitamin C, I take 2,000 a day at least. Just give you an example. Then you have to get a prescription. Wow. So, yeah. So things are really getting crazy. In the back, yes, you have one. Yes, you have.
I don't know when it happened. I think it was in the 80s. These people who manufacture and build prostheses, they have to be licensed now.
That's right.
They have to have college degrees, all right? And on top of that, if you go to buy one and you're going to pay cash for it, you're not going to use your medical card or Medicaid or anything like that. You still have to go get a physician's prescription.
That's right.
Which I consider an obscenity.
Yes. And also, just to give you a little clue, those medical devices, as they're called, are also regulated by the FDA. And if I told that story, it would look twice as bad as this one. And in fact, Obamacare is now taxing medical devices. I think it's a 2.3% tax. The Stryker Corporation, which makes medical devices and whose founder supported Obamacare, has slashed their workforce because they can't afford, they have to react to the tax. In the back.
I wanted to ask you about patents in general. They seem to be a way to protect property rights, and it also seems to be a government-granted monopoly.
Yes.
Which one is it?
Okay. Well, I know a lot of libertarians believe that patents help protect intellectual property. But I have several patents, and I can tell you it's a game. It's a game. Patents are not what we think of as intellectual property. And it's how well you can tweak the system. So I don't think patents are a good idea. They aren't, and they aren't usually necessary except in two industries, according to studies. And that's in the pharmaceutical industry and the chemical industry, two of the most highly regulated industries. And now you can see why. You can't recover the costs of development unless you have a patent. So it's like the patents have been made necessary. When I first joined the Upjohn Company, we didn't need a patent to develop a drug, but as cost increased, we did. Because I was in the pharmaceutical industry when this big increase that you see occurred.
So what you're saying is Amazon doesn't need a patent on one-click shopping.
I'm sorry, say again.
You're saying Amazon doesn't need a patent on one-click shopping.
Can I have a royalty-free license on all of your patents? You said you don't believe them.
Well, look, I don't believe that they are intellectual property as libertarians say them. And I also don't believe they'd be necessary. But the problem with
necessary
government...
in the context of the regulatory framework?
Yes, they are necessary in the context of a regulatory framework. If we didn't have patents for pharmaceuticals, there would be no drugs. Now, maybe we should do that so that people get wise, but right now that's what they're doing. So that's why you have to get a patent if you want to develop a drug, which is why a lot of inexpensive nutritional products are not advertised, even to the extent of the FDA coming down on walnuts and cherries. Come on. How crazy can we get? Yes.
Yes, I'd just like to respond to that smile on your face, because people and libertarians and everyone takes it as oh, how silly and stupid government is. Mm-hmm. But we are dealing with ruthless, brutal political oppression. And that's what we have with government regulations. They are in place to favor the special interest and reward them and deny people, regular, ordinary people who pay their taxes to all these regulatory agencies. This is a brutal and ruthless legal system that allows that to flourish.
No, I agree.
So that's the evil of it is overwhelming. We're not talking about something that's look at how silly FDA is. It's evil, institutionalized evil, and it's just disgusting.
Well, it is, and I'll add to what you're saying. Yes, at the base it is, but most people don't see it that way. They think the FDA is protecting them, and that is why I'm sharing this information with you today, because the people think Obamacare is going to protect them. Of course, most people, I think, are going to find very quickly that it's not. But what you're going to face as libertarians and libertarian candidates is saying, what's better? What's the alternative? So I'm leaving you with the message that the alternative is deregulation. Thank you.